I'm Lisa Palmieri, MD. I'm a pediatrician and I work at Intermountain Healthcare Sandy Clinic. I initially was adamant I wasn't going to go into medicine because I have a lot of medical people in the family and there was a big push for me to go to medical school, and I said I was going to do anything but that. And then I tried teaching for a year overseas and felt that wasn't really a good spot for me, and read a couple books about physicians' life stories, and that kind of turned me on, and I thought I was going to be a psychiatrist. Was my plan to be a psychiatrist. So I went to medical school with that goal originally in play. I did my a pediatrics rotation at Seattle Children's Hospital when I was in my 4th year in residency, and realized that a pediatrician wears a lot of different hats. They're not just a physician, they're an advocate for children. They can get involved with legislative actions that involve children. They can get involved with health issues that involve children, safety issues. And so you become kind of the guy on the white horse with the white hat who gets to come in and do some good. And so it was the first time I understood that that was a role for the pediatricians, was watching the residents at Seattle Children's. They were holding a news conference about a piece of legislation that would affect schools. And so all these young doctors got on TV and said, this is bad for kids. And so they were able to make a difference in the legislation, and that really appealed to me. I really like to hear people's stories. I love to hear the funny things that happen to families and the weird and strange and difficult things that happen to families. And within the room, there's a lot of kind of privacy to sort of talk about how life really is, and to provide comfort and support and resources for families who are struggling through child rearing. It's not easy to do, and it takes a lot of courage to do it, particularly if your child has any special needs. And so it's nice to be able to listen to how they're succeeding and where they feel struggles, and it's a privilege to be involved in that. Because our practice has chosen to be a medical home, it means that I am actively recruiting these children who have multiple medical needs. It means that I'm comfortable with G-tubes and trachs and vents and PICC lines and ports. I'm happy to talk about school problems, about autism, about developmental problems, about psychiatric problems. And so while we have a fair number of children in all of our practices that are growing and developing without significant problems, we also have a lot of room to deal with the more significant concerns. And we utilize a lot of resources to do that. In the community, resources that we know through the Children's Hospital, and resources that we have among the families here. We try to connect families. I try to connect families to each other, particularly in ways that they can help and provide services for each other. I've been able to make some very deep friendships with the moms, and we really work together as a team to keep these children healthy and well, and that's been very fulfilling. One in particular was very, very complicated, and I think we've managed to do good work between his mom and I, advocating for him with specialists and keeping his multiple needs all kind of moving at the same time and dealing with new concerns that come up. And the relationships that I forge in this setting are meaningful, I think, both for the family and for me.